And heads up, this meeting is being recorded, so for your awareness. We're going to get our quarterly meeting started. Again, thanks for joining, and as a reminder, OASAS is hosting, in collaboration with both OMH and DOH, this quarterly meeting so we can provide the community with updates on the status of the opioid settlement funds and the work that we're accomplishing using those dollars. So welcome to all. I do want to go around and introduce other folks, or have other folks introduce themselves who are joining us. I'm going to start by asking Debbie Davis from OASAS if she could introduce.
Good afternoon, everyone, and thanks for joining us. I'm Deborah Davis, and I am the Associate Commissioner for the Division of Fiscal Administration.
Great. We also have Chris Smith joining us. Chris?
Hello, I'm Chris Smith. I'm the Associate Commissioner of Adult Community Care from the Office of Mental Health.
Great, thanks. And Tina?
Am I unmuted?
You are now.
Okay. My computer just froze, so hopefully I am unmuted. Hi, Tina Kim. I'm the Acting Deputy Commissioner for the Office of Health Equity and Human Rights within the New York State Department of Health.
Great. And then we also have two of the staff who are part of the Opioid Settlement Fund Project Management Team who are joining us. Lucia, hopefully, I know her computer was freezing as well. And it may be still. So Lucia does serve as our project director for the OSF effort. And Celine.
Hi, good afternoon, everyone. I'm Celine, and I'm the project coordinator with the Opioid Settlement Funds here at OASAS.
Great. So we're going to jump right in. As you know, the meeting is always recorded, and note that we do post the recordings for the meetings on the OASAS OSF webpage. So if you'd like to share the information with colleagues or others who are not able to join during the actual live meeting, know that they can always refer to our recorded version that's posted. Know that we post the dates for our meeting on the web page as well. So please refer to that or bookmark it so you can stay apprised as to what's happening with our meeting schedule. Celine did just add the web page to the chat, so you have access to that. Just as a reminder, we haven't met in a little while, so as a kind of a refresh, New York State is working to make available dollars that were part of the Opioid Settlement Fund, which was part of a national settlement with each state receiving dollars as a result of litigation that took place with pharmaceutical companies and their role in the opioid crisis that we continue to deal with. The OSF project management team at OASAS is in place to help support the work that we're doing in making those dollars available. Note that those dollars that we do have through OSF, we work in collaboration with DOH and OMH in making those dollars available. And for initiatives where it's relevant, where it makes the most sense, we also include the DOH and the OMH system and providers in eligibility for some of the work that we're doing. In addition, DOH does have an amount from the opioid settlement funds from both 2023 and 2024 that they are making available through their own direct efforts. The work that we do is advised by the Opioid Settlement Fund Advisory Board. And again, a great resource, the OASAS website. We do have a page for the Opioid Settlement Fund Advisory Board where you can actually view past board meetings, and you can also note when we have upcoming meetings. So there's a lot of information available there. And of course, here we have our community meetings. In terms of the board, just as a reminder, and again, wanting to provide some context because we haven't met in a little while, the board does include 19 appointed members, and they do provide and bring to the table diverse experience with regard to the opioid crisis and delivering services to folks across the state. The board makes recommendations in terms of how OASAS should allocate our dollars. And again, there are periodic meetings. During those meetings, there are opportunities for the public to provide input and provide comment. So if that is of interest to you, please make a note of when the next board meeting is. And then there's an annual report that comes out in November that actually summarizes, some of the work that we've done, and then also additional recommendations. And as we go through and in subsequent years, those recommendations that are made are likely to be revised. So the first report that was issued in 2023 actually contained recommendations that applied to our work and the appropriations made available in both 2023 and 2024. The board will provide recommendations for the allocations made available through the 2025 budget and so on. So I keep talking about the OSF website and what OASAS has to offer. So here's a screenshot of the Opioid Settlement Fund website. Know that we do post information on current initiatives, even in terms of active RFAs. We do update as we go through the RFA process in terms of awards made, and try to provide as much information as possible through the web page. So it really is a great resource for folks. Included is our OSF fund tracker. Actually, here you see information that regarding dollars made available in fiscal year 2024. There's also an additional table, which we don't have a screenshot of here, but an additional table that also shows you dollars allocated by priority areas identified by the board. So thank you to Celine. She popped the web address in the chat. So a great spot to go again to access information on how we are making the dollars available. Part of the Opioid Settlement Fund includes regional abatement, and so there is an amount that is allocated to each region within New York State, and OASAS is responsible for allocating those dollars, and how we have chosen to do that is based on formula identified an amount per county, and we actually work with our local governmental unit to make the dollars available directly to the LGU. From our perspective, this makes the most sense in that the LGU is charged with the oversight and management of behavioral health services at the county level. They are aware of what the current and local needs are in each county, and so they're able to utilize the regional abatement funding to address some of those gaps in services and the needs of the county. So not only are LGUs eligible, but based on the settlement agreement, there are the 5 large cities in New York State that receive dollars, as well as other little litigating entities, which do include small cities and towns who have a specified amount available to them from the Opioid Settlement Fund. The project management team did conduct focus groups with the LGUs and other litigating entities to find out how they were using regional abatement, how they were planning for that work. And we do have a draft report right now, and hopefully we'll be posting on our webpage and making available what they shared about their process in determining how to best use these dollars. As you can see, $64 million in 2023 was made available, $46.3 million in 2024. So you do note that there's a decrease from 23 to 24. Know that based on the settlement agreements that there is an amount that is made available from year to year, and it is subject to change based on what the agreements were and the dollars that are ultimately made available. In terms of the work that OASAS has done so far, based on the 10 high priority areas identified by the board, OASAS has started and did start with the harm reduction area as the highest priority. And we had issued an RFA, the Comprehensive Low Threshold Buprenorphine Services RFA, whereby we funded 15 providers that are serving 21 counties to make buprenorphine available to individuals in need of medication. And as it says, low threshold, low touch, in order to make medication as readily available to folks as possible. We've also put funding from the OSF into our naloxone and fentanyl and xylazine test strip distribution. There is data available on the OASAS webpage, which I strongly encourage you to view. Know that in terms of, and I think this is an accurate number, and Lucia and her team will check me if not, but even in terms of the fentanyl and xylazine test strips, we've made, I believe, 10 million test strips available across New York State since we began distribution this past summer. So know that we really have been able to reach a lot of folks with supplies. Similarly with naloxone, we do have our portal available on our webpage so that anyone in New York State can access naloxone, request that they have naloxone shipped directly to them. Again, more information on our webpage, huge effort, very proud of what OASAS has accomplished there. With regard to treatment, we had issued the Comprehensive Integrated Outpatient Treatment Program, RFA, and we actually are providing funding to 19 providers who are in varying stages of the integration process in 18 counties. And I want to also be very clear, with regard to this initiative, we're talking about within the OASAS system, integrating our treatment programs, our treatment program models. So in this instance, what we have done is, in wanting to ensure that folks have access to all 3 types of medications for OUD, that our outpatient programs and our opioid treatment programs become integrated. So individuals can get access to methadone, buprenorphine, or naltrexone, regardless of the program location that they go to. So this is specific to the OASAS system. In terms of investments across the continuum, our Addiction Professional Scholarship Program launched. We have 3 4-year schools and 10 community-based training programs, all with part of the state education system. So community colleges or 4-year programs that are part of the state education system. And we're also adding an additional 15 community and technical colleges to be sure that we are providing opportunities across the state for folks to use the scholarship program to be able to complete CASAC training as well as SERPA training. Again, more information available on our website. In terms of priority populations, we're supporting 18 providers who are delivering services in community, reaching 29 counties. And so folks are able to, our providers are able to go into the community to engage with individuals who may not normally feel comfortable going to a clinic program, or individuals who are congregating on the street or even living on the street. We're going out to reach those individuals to offer them engagement and services. One really important thing that I want to mention is that where the opioid settlement funds are being used to cover those 29 counties, know that this is just part of OASAS's effort to offer outreach and engagement services across the state. So know that we do also have, in the remaining counties, we do have the same or similar services being delivered, not through the auspices of the OSF funding, but nonetheless, OASAS is providing outreach and engagement services across the whole state. In this instance, we were able to utilize OSF to ensure that all counties have those services available. And then for the Connections to Care project, we have 11 providers who are working with vulnerable populations in 9 counties to ensure that folks have access to care. And this is not, this is you know, specific when we say vulnerable populations. These are individuals who may have difficulty accessing services because they have more complex needs, and it can be challenging to find a program that is able to manage both their treatment as well as these additional complex needs they may have. And so through Connections to Care, we're able to really leverage and make connections within areas to ensure that people do get connected to the care that they need. Finally, transitional safety units are the work that we're doing through the housing priority area. We are continuing and expanding on subsidized housing for this use of funds in 17 counties. And the concept here is providing folks with safe living space that they can use, whether that be post-incarceration as they transition into the community and are engaged in treatment services, or as people perhaps come out of a residential setting and rather than not have a safe residence to go to, they are able to utilize these safety units. This is to prevent people from having to do things like utilize a homeless shelter program because they don't have safe housing when they exit a community living situation or a system. And so we're happy to build on work that we've done actually through the supplemental block grant funding to expand on this. Further, in recovery, we are supporting 26 providers in 25 counties to expand on their recovery community and outreach centers. This is a huge piece of work and certainly an area where we see peers play a really important role. So we're happy to expand on the work that our recovery centers are doing. In prevention, we are supporting coalitions. So we have 5 community coalitions that are supported through OSF to expand on work that we're doing with coalitions across the whole state to really be able to address the local issues, the local concerns in communities. Under transportation, we're utilizing funding for non-medical transportation. So we do have 12 providers who provide transportation services in 46 counties. And this is really, you know, a much needed service for individuals to get to appointments. Then not just an appointment to get to a treatment program, but appointments, they could be medical appointments, could be appointments to meet with other types of service providers that they are engaged in and working with. It could be a ride to the grocery store to get groceries, right? So just to meet basic needs. So a much needed service, great that we're able to reach folks in so many counties with this support. And then for our media, we have ongoing public awareness campaigns that our communications folks are working on. Hopefully you've all seen some billboards or a commercial letting people know that there are harm reduction supplies available, that you can request those and mention of our portal as I had done earlier in our meeting. So hopefully you know what I'm talking about when I say that we've had some public awareness campaigns running. And then finally for research, and actually this is an RFA that is currently in the scoring process where we are looking to partner with an academic institution to build on the work that we're doing around the OSF evaluation. So lots of work going on and continuing. One of the, I think I don't know if I want to say fun, but kind of fun, local impact initiatives was also an area where we wanted to ensure that folks who were not traditionally part of the the OASAS system, small community-based organizations, that they would have access and opportunity to do something with opioid settlement funds. And so in this instance, we were targeting local community-based organizations. Folks were offered an opportunity to submit a very brief application requesting dollars. We have made 34 awards and made available $322,075 through those awards. Of those 34 awards, they went to entities in 22 counties, and we've reached 8 of our economic development zones, or Empire development zones, through the Local Impact Initiative. Again, more information available on our webpage. As I said, our Government Academic Research and Evaluation RFA is closed, and we are in the scoring process, and there is one award that we expect to make as a result of this effort. Our Leadership Institute, the intention of which is to provide opportunities to folks who are interested in moving into middle management level positions within the SUD system, and even across the continuum. I'm not talking just treatment, but really provide like professional growth opportunities for folks within our system. So to really develop the workforce. So this opportunity had closed on the 25th. One award available, and scoring is currently in process. We're really excited about and looking forward to this. And then finally, we did have a third round of the Comprehensive Outpatient Treatment Program initiative. Again, this is where we are integrating our OTPs and outpatient programs. So within the OASAS system, wanting to make all forms of medication available to individuals, regardless of what program or what door you walk through to address your opioid use disorder. Scoring is in process, and we have the ability to make up to 17 awards. So that is a lot, a lot of talking by me with regard to our efforts here at OASAS with opioid settlement funds. I'm going to ask Tina if she could give us an update on Department of Health efforts, and I will stop sharing and I can bring up the tracker if that would be helpful.
Thanks, Connie. So again here, Tina Kim, here for the New York State Department of Health. And on behalf of the AIDS Institute, which has been leading the department's work, also in collaboration with other offices here within the New York State Department of Health. We continue to make progress on the department's allocation of the opioid settlement fund dollars, but nothing specific to report. Yeah, just wanted to quickly share that the request for applications for the Department of Health's coroner and medical examiners work is being reprocured. There has been, funding that has been paid to local health departments for their work on reporting overdose death reports. We are continuing to make progress with respect to the priority populations funding recommendations and the New York Matters contract, which are currently undergoing internal approval processes. At the last meeting, there was mention of the work related to health hubs and syringe exchange program contracts that are being executed and funds are being spent. And we also reported last time with respect to the department's contract with AMFAR and the fact that the funding was spent and work continues in that space. So thank you, Connie, for pulling up where New York State Department of Health initiatives are cited, many of which are in progress. We're happy to take any questions or comments related to the Department of Health's work. So thank you.
Great. Okay, so questions. Folks may have, I haven't been keeping an eye on the chat, but certainly please do go ahead and utilize the chat function to send in any questions. I will ask Lucia if she can assist in monitoring this chat and sharing questions that folks may have. And as a reminder too, we do have information and direct links to the Opioid Settlement Fund initiatives. So some of what I had shared earlier, as well as the link to the Opioid Settlement Fund Advisory Board page. So Lucia, any questions?
Yep, we have one here. Oh. Are there any new RFPs about to be released for the next round of settlement funds that we could expect to see in the tracker this month?
So I appreciate asking about the tracker, right? That's where we want you to look to see if there are opportunities available. Know that we continue to work with our 2024 appropriations. There will be decisions made in the coming weeks with regard to making dollars available. I don't have any additional information as to whether that would be made available, those dollars will be made available through an RFP, an RFA, or what the procurement mechanism will be. But certainly do keep an eye on the tracker. And also on our procurements page, we post when funding opportunities are available. So, so nothing more to report, but stay tuned, and it sounds like you know where to look to get the most current information.
And then interested in potential ideas to assist in retention in the field. Scholarships are bringing people in, but we still need to retain skilled staff in the workforce.
So that's a really great point. Know that we have made funding available. So OASAS has, you know, with everyone else, recognize the challenges that we face with regard to workforce. And we've actually looked at the problem, or kind of approached the problem, in two ways. One in terms of retention, and then also in terms of scholarships and internship opportunities for folks. As I mentioned earlier, that what we presented and what we talked about here is what we are doing specifically with opioid settlement funds. And with regard to your question, I just want to, you know, remind folks or let folks know, through our SAPT supplemental funding opportunities, so our supplemental block grant funding, we did make dollars available to programs so that they were able to use dollars for retention bonuses, hiring bonuses, and, you know, we really asked programs to be creative within the parameters set of ways that they could support their staff with those dollars. So we have made upwards of, and Debbie can correct me if I'm wrong, but I want to say between $60 and $80 million we've put out through our initial workforce initiative, and then we had actually 2 rounds of stabilization funding that we made available. And in that second round in particular, it was upwards of $40 million that we made available to support programs, to include supporting staff. So in terms of additional opportunities, I think that, you know, we need to, we will continue to monitor and think of ways we can support programs. Deb, did you want to add anything to that?
Yeah, I would just say this is you know, it's a challenge for the state. You know, there's a lot that has been released and a lot being talked about. So there will be more to come, but I'll just say that related to those initiatives that you spoke about, you know, providing some stabilization funding that, you know, allows you to have funding to do things with your staff. And then you have, you know, stabilization funding to fund, you know, other things that you might have not had enough money to do because you were putting investments into the staff, or, you know, giving them training, giving them, you know, niceties to retain staff, right? But The issue is, right, that was through our SAPT supplemental funds, which was from COVID funding. So it's one time, right? And then we have, OSF funding, which, although we do multi-year initiatives right now, which is fantastic, but the way the settlement funds come into the fund, it's not possible to continue to fund every initiative that we're releasing at this point in time, right? So using that money to add to somebody's salary and then taking it away would not be helpful, right? So that's where other investments like cost of living adjustment that has been provided by the state, 5.6% and 4%, and we'll see where we land when we get to an enacted budget. That allows another way to invest into the staff. But we are constantly working on ideas and talking with associations and providers. So we really appreciate you, bringing it to light. And we are, as a state, looking at all possibilities. And the other thing, we did make significant amount of investments. I know this doesn't impact everyone, but certainly in Medicaid rates across the board for all OASAS services have received an enormous amount of reinvestment. So, we are working frantically to help you.
So just thank you for funding the RCOCs. That's the recovery centers for people on the call who might not be familiar. I'm the director of an RCOC in Syracuse, and the funding has made such an incredible difference already.
Awesome. So thank you, Caitlin, for the thank you. Sometimes, we tend to hear about where we're not delivering or where the gaps are, and it's great to hear where we have made funding available. And so for folks' awareness, OASAS supports through various funding streams upwards of, I want to say, 32 recovery centers across the state. I might be off by one or two. And with the opioid settlement funds, we were able to actually bring every recovery center's operating budget up to $535,000. So for some of them, that was a significant increase. For others, less so, but still, they did receive additional funding. So Caitlin, we're really happy to hear that it's made a difference in your community. That's awesome. And again, thank you for just your appreciation. Your appreciation is appreciated.
Will there be another round of local impact initiative funds?
So that's a really good question, and I think that's something that stay tuned on that. I think that there are dollars that we would like to utilize to continue supporting. So likely, I'm going to say likely. I'm going to put myself out there and go out on a limb and say likely. Debbie.
Yeah, I mean we're looking at all sorts of different opportunities. So glad to hear that. I mean, I think I'm reading into that question that somebody would like to use it. So that means, but I will share something that is actually really important to share, because at the time when we released the local impact opportunity, this requirement was not well clarified, but it is now, and all state agencies are being held to it. So all entities that are non-for-profits that could be able to respond to an opportunity that we put out there, you now have to be in Grants Gateway and in SFS to receive funding from the state. There was a change with Grants Gateway. It is now in SFS itself. It's a module in SFS, and I will, once I'm done speaking, I'll copy and paste where you can go to learn about that. And there's training materials on that portal and everything. So you must have your documentation, updated Grants Gateway module of SFS to receive funding, from any of the state agencies. So that was not a requirement initially for the local impact, smaller grant dollar amounts, but now it is regardless of the dollar amount. So just wanted to make sure that that was well understood.
And actually, that's a really good point, Debbie. As I look at another question that came in, it was about a question about funding opportunities for other recovery centers. And so there is a recovery center that's starting up. They've been in operation for about 9 months, and they were wondering about additional funding. So I don't have an update or anything I can say in terms of the availability of additional funding for new recovery centers, but Debbie's point is well taken in that if you have not engaged in state contracting in the past and you are interested in at some point receiving an award and getting a state contract, you do have to follow the steps that Debbie just mentioned in terms of being an eligible entity, being registered in Grants Gateway. That's as much as I'm going to say because I'm not the expert, Debbie is. But know that for any provider who hasn't yet worked with the state system, there are steps that you can take. Even though you haven't received an award yet, there are steps that you can take to position yourself to be readily able to earn an award. So Debbie, I know Grants Gateway, and you just said it. Would you say it again?
Yeah, it's in the statewide financial system, which we call SFS. That is, the system of record of how payments are released from the state to entities. And so that I didn't say what that acronym stood for, so I apologize when I was just rattling it off. But now Grants Gateway is a module within SFS.
Okay.
So I just put in the chat, the website to the SFS vendor portal. So you would go there, but I also will add a few other details of where you can find training materials about how to use the Grants Gateway module within that. So that'll be added as soon as I'm done talking.
Great, thanks, Debbie. Lucia, I stepped on your toes there, but
no worries. So from the same person, Connie, follow up just from the Startup Recovery Center. Do we have any plans to improve accessibility for people with disabilities to all grant recipients?
I'm not clear.
Yeah, I'm not sure if you mean accessibility with regard to the RFA process in terms of applying to grants, or accessibility with regard to folks with disabilities as a target population.
Yeah, so if the person asking the question could clarify that in the chat, that would be great. That would be helpful, and then we can circle back.
I think she said to serve the public, as in like as a target population.
So individuals with disabilities as the target population for services as made available through an RFA?
Yes. Yep.
Okay. Okay. So we do have priority POPs, and actually I'm thinking, and Lucia, you're going to have to help me with regard to, was it Connections to Care?
Yes. Yep. Connections to Care had disabilities, any sort, physical or developmental, as a priority population. And I believe we do have awardees utilizing that category.
Mm-hmm. So certainly we do put thought into the target populations that we want to set as priorities. And with regard to Connections to Care, the applicant could identify which priority population they wanted to build services for and engage with. And so I don't know off the top of my head, but the awardees for that RFA would be noted in the press release. There is a link to the press release on the Opioid Settlement Funds page. So you could look at that to see if any of those awardees had selected individuals with disabilities. And again, as we develop RFAs, we really try to be comprehensive and think about what are the needs and what are the target populations we should reach. Always, open to feedback on that as well.
And then there's sort of like discussion and a little bit of back and forth in the chat regarding OTPs. So there's been an increase in opposition throughout the state, unfortunately, to expansion of OTPs. For those on the call, that's opioid treatment providers. This could be a barrier to using some of the funding that is specific in the RFPs. Is OASAS working with LGUs and counties to address these increasing concerns? Has come up at various coalition meetings.
Mm-hmm. Mm-hmm. Yeah, I mean, I think that, you know, that is an issue that we're facing in various parts of the state. OASAS is aware of that and addressing that. We do work in collaboration with our LGUs and providers who are interested in establishing OTPs. I also, you know, want to remind folks that the comprehensive outpatient integration program that I had talked about and an initiative that we're supporting through OSF is really intended to be able to make methadone available through outpatient programs and also ensure that a traditional OTP where folks would be accessing primarily methadone, that they are able to offer the other two types of medication to address OUD. So, so we are looking to expand access and looking how we can utilize our existing system to expand that access. I you know, certainly know that, and our commissioner has said repeatedly, you know, that methadone is a medication that works and meets with a great deal of success in terms of helping people to establish recovery and be healthy and well. So we will continue to look for opportunities to expand that and make that service available. So it's a work in progress.
So Sharon McDougall, who's the DCS from Cortland County, said we've been working for over a year to get an OTP open in our rural county. Very close coordination with the provider. So many delays to get this open for Cortland, OASAS, and now the DEA. So just for everyone's awareness, the RFA that Connie mentioned about integration, you know, that is an 18-month contract. So Sharon's right, it does take some time. There's a lot of steps, but the point in posting the RFA is that you get both financial and moral support and a lot of, you know, support from the OASAS office to make it happen.
Yeah, it is challenging. And you know, as Sharon said, I mean, there are, you know, there's getting certified as an OASAS provider and getting all the pieces in place. And then there's also meeting the federal regulations around providing methadone. So it is arduous. It is a long process. You know, grateful that you're getting closer to the finish line for Cortland County. It is an effort.
Caitlin just said, yes, the RCOC opioid settlement funding more than doubled their budget. And Jeff Savoy said the recovery center enhancement has made a difference in the Bronx-based center as well. We have Debbie's information about SFS in the chat. And I think we might be.
We had a thank you for the rate increases too. So
oh, that's right. That's right. Yep. Oh, okay. So Alex is saying many programs need to support and improve their digital accessibility, such as vision impaired or physical disabilities. Both of these populations need substance use and recovery services, but many programs are not set up for them.
Understood. That's a really good point. And so that's something we'll definitely take back. And it's information that that we will take back and look at. And I'm not sure to what extent providers have, you know, what the accessibility requirements are, or if there are resources needed. We'll have to explore with our providers how we can help them to better make services accessible in the ways that you're talking about.
And Celine popped into the chat. So just Connie rushed us a little bit and said that the RFA for integration had closed. It's actually open until Friday. Not that 48 hours notice is enough necessarily, but it is open and the link is there. So if you want to read through it, it's quite similar to previous iterations of the posting as well. So if it's something you're considering, I would direct you to that page as well. And Jeff is also saying we've experienced strong pushback in East Harlem in trying to get out of the gate with an integrated OTP-OP grant. As Brandy states, it's an issue statewide when you're trying to develop these programs.
it's challenging, right? And we continue to, we are making strides. We have, established additional services in rest of state in the last, few years. And we will continue working with our providers in our counties to make those services available. And thank you to Celine for the correction on the round 3 of comprehensive outpatient integration. So closing actually this week, the 29th. So thank you for that correction. Any other questions from folks? So I just want to remind everyone that the recording of this meeting will be posted on the OASAS webpage. So certainly if you want to go back and check to see if you heard what you thought you heard, you'll have opportunity to do that. You can also refer others to the recordings if they were unable to make the meeting today. We will continue to offer the community meetings on a quarterly basis. Date will be posted on the webpage. And we encourage, you and others to join us to be able to ask questions here. What is the latest in terms of opportunities or the work that we're doing? I expect that by the time we have our next meeting, there will be an enacted budget for 2025. And so that'll give us opportunity to continue the work that we are doing utilizing the opioid settlement fund. So given there are no other questions, I'm going to thank everyone very much. I hope that you have a great rest of your day and rest of your week, and we will see you next time around. Thanks, everybody.